Secrets Revealed, What Men Have Not Been Told About Hormones. With our special guest today, Dr. George Moricz. Dr. Moricz, it's a pleasure to have you with us.
Oh, thank you for having me tonight, Chip. I appreciate it.
We're talking about male hormone therapy. I thought that hormones for men were like for bodybuilders and weightlifters and things of that nature.
Well, history does support that. You know, it's interesting. In the 1930s, they took plant sterols and basically developed testosterone. And then we know in Germany, around World War II, they actually wanted to use male hormones to create what we know as supermen. And of course, there's pros and cons to it. Much of the imagery that you see on television and even congressional hearings has been on ways to restrict what's called anabolic steroids or androgenic anabolic steroids. So yes, there has been a bias against male hormones. Now, what is interesting is that they were using male hormones in what's called supraphysiologic doses. In other words, doses that are far beyond that what your body would make even if you're 18 to 30 years of age. What bodybuilders were accused of doing is using very, very high levels and had multiple side effects, everything from their liver to causing cancer and upsetting their lipids and cholesterols. So yes, there is a danger in using that high level. Now, what we do know is that there are a number of men suffering from androgen deficiency, and what I've identified through questionnaires and speaking with men is what's called the ADAM, or androgen deficiency in the aging male. So men will often come and they'll have sexual problems, decrease in sex drive, problems with erections, lack of energy, decreased strength, endurance, lost height, kind of stopped enjoying life, losing their edge, sad and grumpy. They can't play sports well anymore. They fall asleep after dinner and decrease work performance. And this has been related and correlated to actual male hormone levels.
Dr. Moricz, you talked about androgen hormone deficiency. What actually is androgen hormone deficiency?
What we have done through laboratory testing in correlation with questionnaires is look at levels that may be normal in your 20s and early 30s and basically correlate them as we get older. For instance, let me give you a very important historical perspective. In the 1950s, for instance, we had 1 million diabetic men. Now we have 10 million diabetic men. Also, what we've noticed from the 1950s till now is we've noticed a huge drop in testosterone levels. So when we do blood work, we can actually do what's called hormonal assays, measure hormone levels, and we've noticed a huge drop in testosterone assays. In men being worked up for fertility, we've noticed decreased sperm counts. So what's happened? Well, there are different theories about environmental xenoestrogens or chemicals, pesticides that actually have toxically affected men, but regardless of the cause, we've noticed a huge drop in male hormones. So what we used to see years ago in 70, 80-year-old men, we're seeing younger and younger men. I mean, I have some men as young as their early 30s coming in for treatment. Generally 40s to 50s when a lot of men go through those symptoms, especially the sexual dysfunction, loss of energy, lack of well-being. They've got the gut in the middle. I mean, they're just not feeling very good.
Dr. Moricz, you talked about the androgen hormone deficiency and what it was all about, but what are some of the symptoms? How do I know if I've got a deficiency?
Well, there have been quick surveys done, and in many men, if they can be brutally honest with themselves, they notice some drop in sex drive, sexual performance, erections, lack of the morning erection. Basically, they don't feel as virile as they used to when they were younger. So that's a pretty easy way to start. Then there's a constitutional group of symptoms, everything from their energy, ability to concentrate, mood changes. Some even feel depressed, basically just not enjoying life the way they used to.
What are some of the risks of this hormone deficiency?
I'm really glad you asked. For a long time, we used to think, well, men come in with sexual dysfunction or lack of well-being, we replace the male hormones and that's it. But when you look further, you start looking at bone density studies, and one of the reasons that men have less osteoporosis or thin bones than women is male hormone. If you look at muscle strength and muscle size, that's directly due to male hormone. That's why young and middle-aged men develop muscles and women have a much more difficult time doing that. We've even taken studies further and actually shown that if you have low male hormone levels, you're increased risk for heart attack as well as prostate cancer. I mean, so there's some real risks in having low male hormone levels. I'll even go a step further. In the last several years, we've actually shown that diabetes can be reversed. We've had men on insulin who need less insulin. We've actually even found men who are having trouble with type 2 or acquired diabetes. And in fact, when you start replacing the male hormones and watching their laboratory studies, what you're noticing is they're dropping what's called visceral fat. They have less insulin resistant, basically better control of their diabetes.
Okay, you've talked about the risks, the symptoms, and the actual deficiency itself. Let's say that I'm fit into that category. What are my treatment options?
Well, when a man, is evaluated for male hormone deficiency, we always start with a good history and physical. We want to look at things like sleep apnea. We want to look at maybe a prior history of prostate trouble, even cancer. So we do a good screening, then we sit down and we look at a number of laboratory studies. In other words, I just don't look at male hormone, I look at growth hormone. I look at the proteins that bind up male hormone because there is a deeper way of looking at just male hormone. It's not just one number. Then we look at estrogen levels. You know, believe it or not, men actually do make estrogen. And a lot of times men who are heavier are more prone to do that. So I look at a myriad of hormones. Just like a basketball team, you have different players. Well, when you're looking at male hormone, you look at all the others. Then finally, I correlate that with a questionnaire that I referred to earlier, that ADAM questionnaire, the Androgen Deficiency in the Aging Male questionnaire. So I look at their symptoms, and then I try to see where they are with laboratory studies. So we look at the full picture and see what the patient would succeed, what form of male hormone. Now, there are different forms of hormones, and I'll mention some of them. Some are gels, some are by mouth, some underneath the tongue. There's injections, and there's even pellets. Well, one of the things that you often find, and there's a huge market, the pharmaceutical industry is taking advantage of, is gels. A lot of men are placed on gels that go to a primary doctor, but there are some problems with those. And in just a brief sentence or two, gels may not get the high levels of male hormones you need. And after 3 to 6 months, a lot of it turns into estrogen, so they don't really do well. The orals, just like we talked about earlier about bodybuilders, a lot of the bodybuilders had used oral or taken by mouth, and that goes to the liver, very toxic if used at higher doses. So you have to be very careful. There are some studies where you can actually give it underneath the tongue, but it doesn't last as long. Injectables, there's a lot of room for that, and I love using injectables because you can adjust different doses, use different types of male hormones. In other words, I can massage the effect. You know, experts in hormones are able to figure out what doses to give and how to alter them. My most exciting thing that I could talk about is what's called bioidentical hormone pellets, where twice a year I take these rice-sized grain bioidentical pellets made from plants and I insert them under the skin. It takes 2 minutes. Now that's a very exciting approach to male hormone replacement.
Dr. Moricz, is there a danger of getting too much of this hormonal therapy? In other words, can too many hormones be injected or given or taken? I've seen several instances with men going to just general practitioners and general physicians that, you know, things have not worked or worked out negatively.
Precisely true. Let's go back to something we talked about earlier. I'm so glad you brought up the bodybuilders and athletes. You see a lot, congressional hearings and so forth. There certainly can be an abuse of male hormones. Let's talk about the bodybuilders, for instance. Bodybuilders can actually, by using such high doses, they can actually shut down their gonads. In other words, you can shut down your entire system. Most men who use physiological or normal doses, they do have 30 to 50% shutdown of what they make, but we are compensating for it by replacing it. So if you take the super competitive athlete, yeah, they can build up fluid in their body, they can build up too many red blood cells, set themselves up for clots, they can cause liver toxicity, they can mess up their lipids, cholesterols, basically. So yeah, there's a lot of risk. Now, if a patient is watched carefully, you give them the right form, you know what lab tests to check, what symptoms to look for, and that's the art of hormonal optimization. You know, replacement, yes, you can put someone on a standard dose and you might get a standard result, but what tends to happen is the body's very smart. You've been missing something. And so, in a nutshell, there's two pathways. One is making the creation of female hormone, and the other is making something called DHT, which is a very powerful and sometimes given a bad name, but it actually can have some positive benefits in men. But it can also affect things like the prostate. So you have to be careful on how you balance it.
So, Dr. Moricz, you're saying that me as a male, my body is making a female hormone?
Yes, Chip. Your body actually, even as you're sitting here, is actually making estrogen. Some is made by the testicles, the male gonads, but a lot of it's made from fat. Fat is basically the most hormonally active organ in your body, and you're just cranking out estrogen. And some men, up to half of men, when you give them male hormone, even though they've been missing it, they basically will convert it into estrogen. And there are some really neat ways where I can block it or prevent the production of it. Let me tell you another story that's really very historically important. Years ago, we thought that male hormone stimulated the prostate. You got prostate cancer. So they took prostate cancer patients and they treated them in the usual ways, but then they gave them estrogen. So they got smart and saying, well, if male hormone causes prostate cancer, well, they killed these guys. They got heart attacks. So estrogen really is not good for men. That is completely the wrong thing for men. Now, you do need some to cause you to have a normal mood, and you may need some to protect your bones, and it may have some role in low doses of protecting the vessels, the cardiac vessels. But in general, estrogen is something that you want to avoid in excessive doses.
Too much hormone, not enough hormone. Why can't I just go to my general practitioner, my regular primary care physician, and let him take care of it?
I congratulate patients who have identified a problem, they're not feeling well, and they want to get started right away. And I think that's a great place to start. A lot of the patients that I see have already been to a primary doctor. They have gotten started on certain therapy. But a number of my patients actually want someone to watch all their hormones. They want to be evaluated on a more in-depth basis. They want me to be able to manipulate the things that may be causing them trouble, like the estrogen we talked about. In other words, it just depends on how in-depth you want to go. But I've been very pleased when patients have sought me out because they were interested in going into great detail about what they were expecting from hormones, and they wanted to be watched safely and effectively. And I think that's where a hormonal expert like myself and others can be very, very helpful.
Well, for example, Dr. Moricz, I'm a diabetic. I'm a type 1 diabetic, not a type 2 diabetic. How can this hormonal therapy help someone like me?
This is a wonderful time for someone with diabetes, especially insulin-dependent diabetes, to take advantage of male hormone replacement. Let me share some of the newest things and some of the things we already know. Right now, we're looking at the hormone-immune system connection. It's called immunomodulation. You know, for years we thought, okay, here are these hormones, they signal certain things, you develop sexual characteristics when you're younger, you build muscle, it makes you think a certain way, be aggressive, play good in sports, and get through life, fertility, and so forth. I mean, that's what hormones are about. They're for survival and reproduction. Then, as we start looking further, we start seeing that the lack of male hormones is associated with a number of inflammatory diseases. And the list is too great for me to go into, but I can assure you everything from muscle inflammatory diseases to bowel inflammation, rheumatoid, I mean, the list goes on. Now, with diabetes, we actually have studies that show that men who do take insulin actually use less insulin when they're on the proper male hormone therapy. The other thing we see in both men with insulin usage and those who are type 2 or acquired diabetes is that they actually have better glycemic control, better sugar control when they're on the right male hormone replacement. I've seen in my own practice men who drop their hemoglobin A1C, which shows you how sugar-coated your cells are. They've dropped fat, the visceral fat in their gut, in their midsection. The other thing that we're looking at is we're trying to understand how insulin, high levels of insulin, especially for people with acquired diabetes, may have a negative effect on testosterone and vice versa. In other words, they may be feedbacking on each other. So what you really want to do is get someone's male hormone levels back to their earlier years. They might actually help fight disease, including inflammatory diseases, as well as things like diabetes.
So at what age would I need to say, well, I'm approaching a certain age, I need to go get this checked out? Or would you just wait for a symptom to come along?
Well, one of the things I always look at when I see patients, number one, I've talked at different points in lectures and in our radio shows about obesity. So I'm always looking to see body composition changes. And this kind of goes along with growth hormone as well, which I'll touch upon. So I start looking at body composition changes. I look at the way that a person, their muscular strength and endurance. I look at their concentration. You know, the sexual side effects are usually some of the earliest, and they usually come and say their partners complain. complained, or they're noticing this, that, and the other thing with erections, libido, and performance. When you think about it, there's basically three different things that have to happen for people to have normal sexual performance. There's a part of the brain called the mesolimbic system, and basically this is where you get the right triggers, and this is where male hormone kicks in. Then there's the genital system, and you have to have dilation of vessels, things like nitric oxide blood flow. And then finally there's enzymes, which is where things like Viagra have helped some men, where things are blocked so that there's no deflation of the vessels and erections. So there's multiple levels. If you're taking young, healthy men who have basically open vessels, basically have normal nerve function, no injuries, then a lot of things have to happen in the brain and the genital system. And there are male hormone receptors in those areas. In men, what I'm finding is that it's not just the total male hormone level, but the earliest signs I see is they actually start making female hormone, which kind of goes along with their gain in fat in the middle. So when they stop getting less lean, like in their 30s, when I'm seeing some men, that's probably the earliest sign. So I look at those things. Along with that is their cardiovascular health. A lot of these men are already developing trouble with their lipids. So you can get started as early as your 30s. By 40s and 50s, I am seeing lots of men come to me, and it kind of goes along with what we didn't see years ago, like in the 1950s, the numbers I gave you. In other words, we're now seeing men have lower sperm counts. We're seeing lower testosterone as early as their 30s and 40s, and basically their well-being has been affected.
Well, Dr. Moricz, that's great. Let's say I start some hormonal therapy with you. What type of dietary changes do I need to make to do that?
I usually do a body composition on you first. So I start with a body composition, and I look at fat and muscle. So I try to get that established first. Next, I start looking at your eating habits. What I find is a lot of times when men are low on male hormone, they'll have carbohydrate cravings. What we know about food and mood is the serotonin connection, basically the thing that makes you feel good. So a lot of men will start reaching for more carbohydrate, sugary foods, especially in the afternoon and evening, to boost their mood. So by not having enough male hormone, they're already doing that. So I try to look at their carbohydrate intake, and that kind of goes along with the early pre-diabetes. Secondly, as I start replacement therapy, I start working on their activity, because most men, they are stronger, their recuperation is better, and they can build up more muscle. And that's the thing that helps them the most. Because when you think about things like frailty when we get older, it's your bones and muscle, and then of course your mental status. And if you can help men build up their bones and muscle, they are less likely to become frail, get hurt, and basically get run down.
Another thing that you hear a lot about are growth hormones and people wanting to get bigger and stronger. What's going on with growth hormones?
Well, let's take a male who is male hormone deficient. A lot of times, and I do measure these things as well, I'll look for things like insulin growth factor, in other words, a measure of their growth hormone status. When men have a drop in male hormone and you replace it correctly, a lot of times you'll actually boost as a secondary benefit their growth hormone levels. Now, being very simplistic, because this goes through many different pathways, growth hormone is released in the brain, and then it triggers something called insulin growth factor inside your liver. And the combination of the two actually keeps you lean. In other words, you drop fat. And number two, it does protect your bones, and basically also has a anti-inflammatory effect in your body. See, cells need to grow and regenerate. So there's been a lot of attention, this started in the 90s, of using growth hormone to help rebuild men's strength and basically keep them younger. What we know is that growth hormone can have a benefit for people who have what's called adult onset growth hormone deficiency. In other words, their body composition is off, they have too much fat, very little muscle, despite conservative therapy, including male hormones. Also, their quality of life is horrible. They're socially isolated, they're depressed. Also, they have lipid abnormalities, their cholesterols are off. What we notice in men who use a combination of male hormone and then actually do require growth hormone because they're just not feeling right is they actually do drop more fat, they sleep better, they're more rejuvenated. And one of the benefits, if you can get away with it, is using male hormone only in certain patients, and they actually get a secondary benefit. But I notice about a third of my patients who are on male hormone replacement actually can benefit from very judicious, careful use of growth hormone when needed.
Well, that's some very insightful information, Dr. Moricz. But let's say that me or one of the listeners wants to find out more about this type of process and program. Well, where can I go to learn more?
Well, what we've talked about tonight is the dynamic hormonal balance system that I developed with Body Hormone Balance. And I'm proud to say that this is a very systematic approach. Men can get started by calling 903-794-6962. That's 903-794-6962. Speak with my hormonal liaison. We can get them in, get them screened, let them experience what we do at Body Hormone Balance. Also, while they're waiting to get started, have them check out feelgreattexarkana.com. There's a lot of information to get men started, learn a little more about their health, because really this is the missing ingredient that can help them.
So what's the website one more time?
It's feelgreat, F-E-E-L, greattexarkana.com.
Dr. Moricz, thank you for being with us tonight.
Thank you again.